Good evening and welcome to the COVID-19 update coming to you here at Channels Television's global headquarters in Lagos, Nigeria. I am Kayode Okikolu, and here are some of the highlights. 3 weeks after the safe reopening of schools, senior secondary students get to serious business with the senior certificate examinations. We bring you the conduct of the examinations in the COVID-19 era. No local vaccine production in sight for now, and that's coming from Nigeria's Institute for Pharmaceutical Research. But there seems to be a silver lining. An anti-face mask protests hold across Spain, a country with the 10th highest cases globally. Thank you for joining us on the program. Let's now head over to the nation's capital, Abuja, where the Presidential Task Force on COVID-19 is holding a briefing.
Of our national response to COVID-19, all relevant agencies of government are taking to ensure that the process remains within acceptable international protocols and in line with bilateral agreements. For the purposes of clarity, this should be distinguished from normal evacuation flights, and we wish to state that all evacuation flights will end by the 25th August 2020, after which airports will be given sufficient time to prepare for reopening. You will hear more about this from the Honorable Minister of Aviation as to the state of preparations. Our partners have continued to provide support for our national response. Over the weekend, the United Arab Emirates presented Nigeria with 7.5 tons of medical supplies and also facilitated the return of stranded Nigerians in their country. The Nigerian government wishes to express her appreciation to the government and the good people of the United Arab Emirates and its people. The Presidential Task Force similarly received additional PPEs from the Pharmaceutical Manufacturers Association and Messrs. Chazu San Ma Education Foundation, a Chinese company. Particularly, we remember with deep sense of gratitude the immeasurable role the late Malang Samaila Isa Funtua played in facilitating the donation by the Chinese company. May his soul rest in peace. Before I close these remarks, it is important that I plead with Nigerians to remain focused on our individual and collective fight to win this fight against COVID-19 and not engage in destructive information dissemination. One of such is the viral trend on the social media about collection of sums of money for a COVID-19 negative result. For the benefit of all Nigerians, and has been explained previously by the DG Nigerian Center for Disease Control, samples are only collected at designated centers and not at the airports. It is therefore inconceivable that test results would be given at the airports where only passports of returnees are collected.
Nigeria's Secretary of Government of the Federation and Chairman PTF on COVID-19, Mr. Boss Mustafa, speaking there. Meantime, Nigeria's COVID-19 cases remain on the rise, albeit at a slower rate, with 298 people testing positive for the virus in the last 24-hour period. Well, latest data from the Nigeria Center for Disease Control, that's the NCDC, shows the nation is now almost at the 50,000 infection mark, barely 6 months into the outbreak of one of the most deadly viruses the world has ever battled. 49,068 is the total confirmed cases of COVID-19 in Nigeria. 36,496 patients have been discharged, meaning that 7 out of 10 people survived the virus, while 975 of those infected, unfortunately, have lost their lives. A breakdown of the 298 cases shows that across 15 states and the FCT, Plateau records 108, Kaduna with 49, Lagos 47, Ogun 18, Osun 17, FCT 15, Ondo 14, and there you have the breakdown right there on the screen. In the meantime, the Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwezu, has been commenting on the decision of the federal government to increase the testing capacity across the country. Speaking to me earlier today via Skype, he said Lagos remains the state that gives the best picture of where the country is today in terms of testing capacity. He encourages other states to build on the success so far achieved by Lagos, which has tested over 84,000 samples. The NCDC DG also spoke on the nation's strategic goals.
Where do we want to ultimately get? The two strategic goals I think this government has in terms of this response. One is to control and manage the outbreak itself. But one is to build a health system that will prevent us from being as vulnerable as we have been to the impacts of this one. So in terms of the vaccine, there are global efforts happening. We're participating in it, but not playing the big role that we think we should be playing as a country the size of ours. And that comes to some underlying investments that we have to make in terms of encouraging people, more people to go into science. You can't wake up one morning and say, I want to make a vaccine in 5 years.
Right.
This really takes generations of investment in science.
Okay.
It's almost like developing a love for a subject that we need to survive.
Well, speaking of vaccines, the federal government says the provision of local vaccine for COVID-19, in fact, the production, I should say, might not be in sight soon, but it still says that the country will continue to strengthen the capacity for quality of plants in the country. At a training organized by the National Institute for Pharmaceutical Research and Development, NIPRID, for health stakeholders, the agency's DG, Dr. Abia, however, said the country has quality plans for pharmaceutical products. The training, which is holding in Ilorin, Kwara State, is to increase awareness and improve the knowledge in phytomedicine in the country.
Producing vaccines is not a step you can take in a day, a month, or even a year. Before COVID-19 started, I think it was a couple of years ago, we had a big meningitis scare. And at that point in time, while I was the executive secretary of the Pharmaceutical Manufacturers Group, we engaged government robustly to say that Nigeria not having capacity to locally manufacture vaccines is a big weakness. Because if you have something like meningitis and you go all around the world to look for companies who produce meningitis vaccine, you don't expect the Europeans who don't suffer meningitis to produce meningitis vaccine. Interestingly, the government of the day picked up on that medicine security argument that we put forward and began the discussion of local manufacture of vaccines. And as I'm speaking to you now, government signed an MOU with a local manufacturing company, and they came up with a company called BioVaccines. BioVaccines, I'm aware, has begun operations and has now put Nigeria on the map as regards vaccines manufacturing. But as regards whether that particular company and Nigeria will produce a vaccine for COVID-19, I don't think that will happen.
And now to the education sector. Senior secondary school students today began the West African Senior Certificate examinations across the country, the first of its kind in a pandemic year, where there had been debates over the students' level of preparations and adherence to COVID-19 guidelines, especially for public schools in rural areas where compliance and monitoring might be low. The federal government has given directives to state government and school owners to ensure that these safety precautions are adhered to strictly. It's the third week of school's resumption after a long break caused by the COVID-19 pandemic. Students are not allowed in until they have fulfilled the necessary COVID-19 protocols. The students have barely settled in, and now the exams are here. Final year students across the country are writing the West Africa Senior School Certificate examinations. It's serious business, and the first hurdle they have to cross is mathematics. At the Agidingbe Senior Grammar School in Ikeja, Lagos State, a WAEC official speaks on the students' preparedness.
It is not correct to say that the candidates have not been adequately prepared for this examination. The examination was supposed to start on the 6th of April, and it was bid to end on the 5th of June. They had completed the syllabus. They were just about starting the examination when the lockdown started. In any case, it can be argued that they have even gained because they had extra number of months to prepare. It's only the lazy students, the I don't care students, those who don't want to study, that you can say, oh, maybe they played away their time. The serious ones, they went into reading. And let me tell you, even if you give them 1 year to prepare, those who will pass, and those who will fail, will fail.
Social distancing is not a problem, as seen at Abeokuta Grammar School in Ogun State.
Our policy is that 30 minutes before the exam, every exam, the student should be ready.
In Akwa Ibom State, the materials for the examination arrived late, but that didn't stop the students from writing the examinations.
The only challenge we have is that the exam was supposed to start by 9:30, and all things were set in place, but the delay in bringing the examination material. If you can see from the board, it is written 11 o'clock, that's 11 a.m. That means we delay for about an hour and 30 minutes.
For the next 1 month, the students will be tested across various subjects. And even though the war against COVID-19 rages on, it is expected that they do their best to progress to higher institutions. Dr. Japhet Olugbogi joins us this evening. He is a public health physician and the chairman NMA Lagos Committee on COVID-19. Well, good evening. Thank you for joining us on the program.
Good evening. Thank you for having me.
Oh, you're welcome. Now, earlier on, you listened to the DG of the NCDC talking about testing. And one of the things he said is that, well, we have the capacity, but apparently people are not confident enough to come forward for testing. You interface with the public. What is the challenge here, really?
Thank you very much. People not coming forward to test, now that we have more capacity to test, especially in Lagos, may be due to apathy. And then a lot of people are also probably not seeking care and doing what we call home-based care personally by themselves. Also, I think one other reason that may adduce to that is the fact that when they go for the testing, the results are not, they don't get the results on time. We know the incubation period is between 3 to 6 days to 14 days. Sometimes when a lot of people test, they don't get their results even within the 14 days. So they feel it's not worth their time clamoring to go test when they won't get the results on time.
Let me see if I can squeeze this in just before we go on break. There's been that debate, livelihood. Do we open and then just handle things as they come, or do we wait and allow this to get to maybe level 0 before we open? Is there still that fear, really?
Oh, yes. We may say that that fear is done and dusted, but personally, I don't think it's done and dusted. Yes, we have fewer cases now, especially in Lagos. I will keep using Lagos as a reference point. But then again, I don't think we can say it is Uhuru yet, because we know there are other strains of COVID-19 in other countries, which, if they get their way here, may be more deadly than the kind of strain we have here. So it is not yet Uhuru. So I don't think we are done and dusted yet when it comes to COVID-19.
Let me just put you on the spot here. Do you think there might be a second wave? Because, I mean, you have said it's not Uhuru. Does that not Uhuru mean there might be a second wave?
Yes, possibly there might be a second wave. There might be a second wave, especially when we open the international flights. People from other countries will come in, our people will go to other countries, and then, we are different strains of COVID-19 all over the world. If the strains we have here now, we are able to deal with it one way or the other, we are able to cope
what will
with it.
happen with...
Yes, we wonder what happens when we have a new strain.
Clearly, the war is far from over, but I'd like to thank you so much, Dr. Japhet Olugbogi, for sharing those insights, quite precise. The public health physician and the chairman, NMA Lagos Committee on COVID-19. Thank you so much.
Thank you.
Well, we'll take a break, and when we return, there's been a protest in Spain over the wearing of face masks. We'll bring you that and more when we return. Please stay with us. Well, there you see pictures from the Asaba International Airport in Delta State, which has resumed flight operations after several months of COVID-19 shutdown. Well, passengers are visibly happy about the development, but they believe airline operators must adopt the social distancing rule to complement the efforts of government. The state government is optimistic also that measures put in place, which are in line with the NCDC and NCAA guidelines, will ensure that Nigeria's cases do not spike on account of the reopening.
For about 4 months now, the airport has been closed, and you know the effect on our economy. And we also appreciate the NCAA for also appreciating the good work the state has done in ensuring that we meet up with the protocol well established by both the NCAA and the NCDC. And so, to that extent, we call on Deltans and indeed all users of this airport to take advantage. Good enough, we'll have more flights that will be coming in through this airport. Ibom Air will resume flights on this airport. Of course, you know we have always had Asman and Airpeace, and this is Aero. We're also looking forward to having Arik back to this airport. That means flyers and travelers that take advantage of this airport will now have more opportunities. And you know the effect that will have on the pricing.
Dr. Emel Udo joins us this evening as a chairman, NMA Akwa Ibom State. He's also a general practitioner. He's joining us via Skype. Good evening. Thank you for joining us. Now, I'd like to begin with what's happening in Akwa Ibom State. I know currently the state has recorded 250 cases so far with 8 deaths. But you know, one wonders if that's really a full picture of what's happening as regards COVID-19 in the state, because so far less than 2,000 people have been tested. Is that a concern that you also share?
Thank you very much. Good evening, all. For Akwa Ibom State, I think that's the figure that we're working with, and we've tested. I don't have the actual figure that's been tested as of today. But the confirmed cases, like you said, so far from the start, about 250. Then we have discharged about 208, and about 34 active cases now. Basically, if a fire is burning, it's not that a hidden thing. Everybody sees the fire burning. So if Akwa Ibom State is really burning and we have more cases than what is being documented, I think we should be feeling the heat by now. So I think I will not try and move for now. I'm thinking that we actually have more than what we have. And basically, people who want to be tested are being tested. The issues we have now, most people are waiting until they get sick before they get tested. And the number of sick persons are really not high, but whenever people declare interest for testing, I am familiar with the fact that they are being tested. Apart from being the NMA chairman, I'm also an integral member of the management committee of COVID-19 in the state. Right. I'm also the state immunization officer, so that makes me an integral.
Okay, just before we wrap up this conversation, I know that earlier on in this journey, there were a lot of issues with health workers regarding hazard allowance. There were issues with protection. A lot of health workers saying that if they don't get adequate PPEs, then they're not going to work. I mean, some other issues also came up. And I mean, we're about 6 months into this battle. Do we still have some of these issues really coming up?
I'll say that I'm the new chairman, about 1 day in office. As of today, I don't have such a report on record. But I think what you were just describing was a different issue that occurred at the beginning of the pandemic, when everything was still novel, nobody knew what to do. So when I speak today, I think we've gradually reached a position where I think everything is normalizing.
Mm. Right. I'd like to thank you. Okay. Thank you so much, Dr. Ime Udo, the chairman, NMA in Akwa Ibom State. Thank you for sharing your thoughts with us this evening.
Okay, thank you very much. Thank you for having me.
All right. Well, let's head over to Ekiti State. 5 months after lockdown, Christian worship centers resumed yesterday after the Muslim counterparts observed public worship on Friday. It was a month longer than expected because of government's insistence on rules deemed non-negotiable. The churches adhered to COVID-19 protocols set by government, and their joy of gathering again was freely displayed. Our correspondent, Babajide Agbeyo, brings us this update.
It's 1 month after an initial postponement of religious activities in Ekiti State as a result of failure of stakeholders to reach an agreement on set protocols. But now, the hurdle is scaled and the excitement is palpable. Churches have resumed, and it is noticed that they comply to a large extent with the COVID-19 protocols, hand washing, using of face masks, and other rules. Christian leaders are still asking for more from government.
The joy is not complete because 40% of my parishioners are not here. They are either above 65 or 12 down. Here, by the grace of God, I have over 400 parishioners that are under 12. And when I don't see them, my joy is not complete. But we thank God that the church has been opened partially. And we are hoping the government will still look inward to still relax the COVID thing a little bit.
There's this joy coming to minister, coming in the presence of God. It's just, there's this inner joy. I'm so happy being in the presence of God.
The state government in recent statements has advised religious institutions to stick to the rules so as to hasten victory over the dreaded pandemic. Babajide Agbeyo for COVID.
Well, outside the country, barely days after the world commemorated the World Mask Week, crowds of protesters have gathered in Spain to oppose the compulsory use of face masks and other protocols imposed by the government to curb the spread of the virus. We'll take a look at our website, channelstv.com, which has all the information which you need in different areas, business, sports, and others. And you can find them all at your fingertips. Well, that's the program for tonight. Thank you so much for watching. I'm Kayode Kikyolu. To stay safe.